A feeling that comes through during medical training, through every rotation, through every patient experience you have, is that there's this deep undercurrent for respect for humanity, for the sacredness of human life. Especially true for people who train at safety net institutions like I did and like so many medical residents and medical students did. It's actually very common to train in these environments, and it's a whole nother video why, but I trained at a safety net institution in New York City where I took care of the most vulnerable and marginalized members of society, people who were unhoused, people who were incarcerated, people who were undocumented. There were so many times I would actually catch myself in the beauty of so many of these interactions with the gentleness and the care and the respect that we showed for all of these people. It would touch my heart like quite regularly. And of course, the system we worked in was not perfect. I do not mean to say that all patients were treated equally and that it was just one big like unicorns and rainbows type of situation. No, we know that racial bias has plagued medicine since its inception, that gender bias exists, that there are differences in patient outcomes depending on what you look like. But I think at least the institutions that surrounded us, whether that was the structure of the hospital itself, whether that was the local government, the state government, and even the federal government, there was this idea that there was at least an acknowledgement that we should try to treat people the same, that we should try to treat all people with basic human dignity and respect. Now seeing the ICE raids in Los Angeles and people being dragged away from their workplaces where they are actively contributing to their community and the economy, something is shifting. Something really deep is shifting, and something has been shifting for quite a while. There is this outward acknowledgement that no, we don't want to treat all humans equally. We don't want to even treat all humans like humans. The institutions that surround us are now saying out loud, no, some people don't deserve dignity. Some people don't deserve to be treated with gentleness and compassion and without judgment. And that is really jarring to see as someone who holds that as a core piece of my identity, that all humans do deserve to be treated with dignity and gentleness and compassion. And I keep coming back to and thinking of what Virchow said about physicians being natural attorneys for the poor. I think it's much greater than that. It's obviously not just people who are poor, but people who are marginalized. And the idea is that physicians have this obligation, this built-in purpose to become actively involved in social justice and to advocate for their patients, or even not their patients, just members of their community who are being attacked and dehumanized and in need of care. I feel like this video is just a stream of consciousness, but I hope this is something that we can keep in mind as physicians, as members of the healthcare community, that now more than ever, we need to step up and show care and concern for people who are receiving like absolutely none of it.